Welcome everyone. The first ECG, we have to look for the P wave. सबसे पहले P wave is present in the lead too, so this is a sinus rhythm, and here you can see that they have also provided us with the rhythm strip. So this is a sinus rhythm, but if we concentrate on the strip 2, you can see that there are P waves, but still here the number of boxes that are between the two RR complexes, these are 4 over here, but if we look over here, this is about, they're about 4.5, and here we can see about 4.5, 4.5. So basically when you see a sinus rhythm with irregularity, then don't forget the diagnosis of sinus arrhythmia. All right, now here these, first of all, we have to comment on the rhythm. So this is sinus arrhythmia, the rhythm is sinus arrhythmia, and then after the sinus rhythm we calculate the rate. Approximately if we calculate, it is between 4 to 5 boxes, so जो आपका heart rate है, it is between 65 to 75 beats per minute, almost. And then we look at the axis, both lead 1 and AVF are upward, so the axis is normal. And then we look at the QRS complexes and along with the ST segment and the T waves, though they all are normal. Here we can see that they all are normal. So this is basically the ECG of sinus arrhythmia. In the second ECG, first of all, look for the P wave to look for the rhythm. So here you can find the P wave in lead 2. This is a sinus rhythm. And then after the rhythm, we calculate the rate, the number of boxes between the RR complexes 1, 2, 3, 4. So 300 divided by 4 is about 75. So heart rate is between 70 to 80 beats per minute. And then we look at the axis, both lead 1 and AVF. So lead 1 is upwards, AVF is more downward. This is left axis deviation. Okay, हम axis तक पहुंच गए. Then we start looking at the QRST complexes. QRST here normal, QRST normal, no Q wave, ST normal. Here in the AVL, here we can find a small Q wave, but T waves are normal. In the lead AVF, it's normal. In the lead 1, you can see prominence of the T wave inversions. Look, T wave inversion in V2, T wave inversion in V3. No ST segment changes. QR's complexes are normal, but T wave inversion is present from lead V1 to V5. Here it's normal, and there is normal progression of the R waves also. So if we say this is basically sinus rhythm with left axis deviation, along with that we have T wave inversion with a Q wave, small Q wave with AVL. If I ask you a question that what would you do if a patient presents with the chest pain and who has a chest pain for about 1 hour, and though if you see this ECG, what would you do for this patient? Basically this is anterior interoceptal, acute interoceptal, non-STEMI. So is there any indication of thrombolysis? No, because I have told you the indications of thrombolysis are if there is ST segment elevation MI or new onset LBB. और जो ST segment elevation MI है उसमें भी जो आपकी chest leads होंगी उसमें more than 2 mm, और जो आपकी limb leads हैं उसमें more than 1 mm अगर होगा ST segment elevation. So we thrombolize in ST segment elevation MI, not in non-STEMI. So we will simply give patient, what will we do? We will give aspirin, we will give heparin, we will give beta blocker and a statin to this patient with PCI as soon as possible. In this third ECG, again, first of all, look for the rhythm. You cannot find a proper P wave in the lead 2, and if you see the RR complexes, their distance between the two RR complexes is different in between every RR complex. So along with this fibrils, when you find this is atrial fibrillation. And we talk about atrial fibrillation, you tell the ventricular rate, and after the rate and rhythm, we talk about the axis, lead 1 and AVL. In the lead 1 and AVF, both are upward, so the axis is normal. And then we start looking at the QRS complexes. So QRS, these are normal in lead 1. Here you can see there is ST segment depression in lead 2. So when you find ST segment depression in lead 2, you try to find that whether it is following a vascular pattern or not. तो जो leads आपकी inferior leads कौन सी है, lead 2, 3 एंड AVF. सो इसके अंदर तो ST सेगमेंट डिप्रेशन मिल रहा है, लेकिन इधर आपको नहीं मिल रहा. ठीक है, दिस इज़ नॉट फॉलोइंग अ वैस्कुलर पैटर्न. एंड देन AVR इज़ नॉर्मल. AVL में जो है आपको नथिंग सिग्निफिकेंट. अगेन QRS कॉम्प्लेक्सेस के अंदर आपको जो है लीड AVF के अंदर भी सब कुछ नॉर्मल मिल रहा है. P1 के अंदर अगर आप देखें तो यही फिब्रिल्स आपको मिल रही हैं. बाकी QRS कॉम्प्लेक्सेस नॉर्मल हैं. टी वेव्स भी नॉर्मल है इसके अंदर भी. QRST यहाँ पर लीड V3 में अगर आप देखें तो आपको ST सेगमेंट डिप्रेशन मिल रही है. V4 के अंदर ST सेगमेंट डिप्रेशन मिल रही है. V5 के अंदर ST सेगमेंट डिप्रेशन मिल रही है. और V6 के अंदर जो ST सेगमेंट डिप्रेशन है ये आपकी जो है सॉर्ट ऑफ जो है इनवर्स रिवर्स टिक साइन है. ठीक है ना, रिवर्स टिक है. इसका एक लिम्ब, दिस इज एसिमेट्रिकल टी वेव इन्वर्जन, जिसमें वन लिम्ब इज ग्रेटर देन द अदर लिम्ब. सो ये जब भी आपके पास आता है या तो ये स्ट्रेन पैटर्न होता है या तो फिर ये डिजॉक्सिन इफेक्ट होता है. ठीक है, तो एट्रियल फिब्रिलेशन के साथ अगर आपको इस तरह का पैटर्न मिल जाए तो मोस्ट प्रोबेबली दिस इज डिजॉक्सिन इफेक्ट. तो इस ECG की अगर हम इंटरप्रिटेशन करें तो दिस इज एट्रियल फिब्रिलेशन विद probable ischemia and digoxin effect. Alright, the last ECG, look for the P wave. Again, you are unable to find any P wave in lead 2. Here also you can see in the rhythm leads, and you can see that the rhythm is also irregular. So this is again atrial fibrillation. After that, you look at the lead 1 and AVF. Lead 1 is upwards, AVF is downwards, so this is left axis deviation. After that, you start looking at the QRST complexes. QRST यहाँ पर आपको M पैटर्न मिल रहा है lead 1 के अंदर. along with that आपको T wave inversion भी मिल रही है lead 1 में. So जब lead 1 में इस तरह से मिल रहा है तो आप इसका vascular पैटर्न देखें. lead 1 आपके पास lateral lead होती है, तो lead 1 में भी T wave inversion मिल रही है. lead AVL में भी आपको T wave inversion मिल रही है, और V5 में भी मिल रही है, V6 में भी मिल रही है. ठीक है, तो ये दिस इज फॉलोइंग अ वस्कुलर पैटर्न. सारा आपका लेटरल वॉल जो है इसके अंदर इन्वॉल्व है. उसके अलावा बाकी उसमें आप QRS कॉम्प्लेक्सेस देखें. यहाँ पर जो है लीड 3 के अंदर आपको थोड़ी सी ST सेगमेंट एलिवेशन मिल रही है लीड, लेकिन 2 के अंदर नहीं है, सिर्फ 3 में है, AVF में नहीं है. तो ये एक वस्कुलर पैटर्न फॉलो नहीं करे तो इसकी इतनी इंपॉर्टेंस नहीं है. लेकिन यहाँ पर अगर आप देखें लीड V1 के अंदर जब आपको इतनी डीप S वेव मिल जाती है ना, वैसे यहाँ पर आपको W पैटर्न भी मिल सकता है, लेकिन अगर इस तरह की डीप S वेव आपको V1 के अंदर मिले, along with that if you find an M pattern in lead V6, this is left bundle branch block. And inversely, if you find an M pattern in lead V1 with slurred S wave in the V6, this is right bundle branch block. So you are finding actually the left bundle branch block along with atrial fibrillation. So if I say that what would you do? Would you do the thrombolysis? The thing is, left bundle branch block